Hey everybody, this is Kevin McFarland from The Art of Emergency Nursing, and you're listening to 30 Days to Being a Badass ER Nurse. In the next 30 days, I'm going to give you some quick tips and tricks to help you be a better ER nurse. And of course, as always, it's not just me you're going to hear from. I've recruited some of my friends to give you some of their tips and tricks so they can share their knowledge as well. So don't forget to subscribe so that you catch all the episodes. And if you find one of these tips and tricks are really helpful, give me a shout out on social media and share it with your friends. Let's get into today's tip. For today, day 7 of the 30-day podcast challenge, 30 days to being a badass ER nurse, I have a little tip for my preceptors. If you precept new nurses, experienced nurses in the emergency department, one or the other, if you precept in the emergency department, you have one of the most important jobs of anyone there. Now, let me tell you, unless your leadership is, crazy and your educators are crazy, which is totally possible, they only ask you to precept because they see something good in you. They see something good in you, and they see somebody that they want to emulate new employees with. So take that as an honor if you were asked to precept. Being asked to precept is absolutely an honor. It's one of the biggest honors we can bestow on somebody in the emergency department. What we're saying is you have good nursing practice, and we want you to teach this other person who may or may not need to know how to be a nurse. But it's a big deal. So take it for the compliment that it is. One of the things you need to know before you precept is what exactly is your preceptee's experience. Are they a very experienced nurse who simply just needs to be shown how to do things on that unit? Or are they somebody brand new that you're going to have to show around and show everything? Because you're going to handle those two populations in a very different manner. So you got to find out a little bit about them. Hopefully you'll be trying to get to know them anyway. But that certainly is a great opportunity. Let's talk a little bit first about precepting an experienced nurse. For an experienced nurse, one of the biggest things you need to do is make sure that they are aware of and where to find hospital protocols. Now, I don't think anyone's got all their hospital protocols memorized, but certainly what you need to do is be a resource and be able to show them where to find them. Now, if there are very specific ones that are important for the day-to-day job, then you need to make sure that they're aware of those. My guess would be is your educators probably have that already kind of squared away and taken care of. And oftentimes these are in their competency-based orientations. Now, depending on the person you're precepting, they may want you to explain everything as you do it the first 1 or 2 times. And some may feel pretty confident in their skills and knowledge. Keep in mind that your experienced ER nurses are going to have a knowledge base, but sometimes being at a different facility, being at a different environment makes things a little bit challenging. Kind of feel your preceptee out for how best they're going to learn. Are they going to want you to show them step by step, or are you going to just give them the stuff and kind of give them the basic guidelines? I can kind of tell you from my own experience, when I returned to the pediatric emergency department, I really wanted my preceptor to explain a lot. It had been a while since I'd been in a peds-only ED, and I actually felt a little rusty. What I found quickly was it was like riding a bike. Before you knew it, I was ready to go and feeling pretty confident with my skills and my knowledge base. I'll never forget, we went in to go start the first IV, and it was on about an 11-year-old chronic child. Started a 22-gauge angiocath on him, and that was easy. That was no big deal. The very next patient was a 2-week-old who needed a 24-gauge angiocath. And she said, "What do you think?" And I said, "All right, let's give it a try." And I remember grabbing that 24-gauge angiocath and thinking to myself, "All right, Kevin, you got this. You can do this." She laughed at me a little bit when I actually took my glasses up and put them up over my head so I had better up-close vision. And I remember looking hard at the bevel going, is that bevel up or is that bevel down? So shout out to Lindsay for being a great preceptor. She really was fabulous. But sure enough, I got the 24-gauge angiocath. It felt good. And, she said as soon as she see me hold the child's arm down and completely immobilize the child's arm, she was like, "Oh, I knew you had this." So it was like riding a bike. What I did need to know, though, was the way they did things. So the way they did things were a little bit differently than the way I learned, the way they taped down the IVs, their expectations for padding the hub and stuff like that. So what you have to learn is you have to learn the institution way. And that there's kind of unspoken rules, but these are the way that everyone does these things. Those are the kind of things you're going to want to give your experienced nurse. Constantly check with them and see if they need explanation. The way I do this to help them kind of save face is I'll ask them, hey, now we do this maybe a little bit differently here than you may have seen in the past. Do you want me to go through this real quick for you? And it helps them kind of save face because it may be something they know and it may be something that they're just not as comfortable with, but they may not want to tell you that they're not comfortable. Give them a chance to protect their ego a little bit. That helps us adult learners, right? Let's talk about precepting brand new ER nurses. These are typically new grad nurses who are just fresh out of school and have had minimal to zero experience in the emergency department. Maybe if you're lucky, they did a capstone there or something, but it's certainly not any experience to speak of. For these guys are going to need a little bit more hand-holding. These guys are going to need a little bit more detail with not only the what's, but the whys. What are they going to do and why are they doing it? Giving them that why helps them develop the critical thinking skills to be able to put the pieces together down the road. So it's critical that not only do you tell them how, but why. For these new grads, if you were a new grad in the ED, I want you to remember how it felt being a new grad in the ED. For me, I was absolutely terrified. I was scared to death. I was afraid I was going to kill somebody. And I started in a pediatric emergency department, so I was terrified the whole time I started in the emergency department. Luckily for me, I had a brilliant preceptor named Sarah. Shout out to Sarah Dakin. Love you. Who took me under her wing and really showed me a lot. I had some skill because I worked in the emergency department as a tech, but it's completely different when you go from the tech role to the nursing role. And for any of you who are listening who are maybe techs in the ER and going to nursing school, it's a completely different ballpark once you get your RN and you're actually responsible for everything that happens with that patient. Luckily, again, I had a great preceptor who her number one role was to be my safety net. Her number one role was to be my safety net, be my cheerleader, be my encourager. And there's probably many things that she had to tell me over and over and over during my orientation, and that's okay. She was willing to do that. But one of the things that she kind of held me to was she was like, get a notebook, start writing this stuff down so that you remember it. And that's exactly what I did. Now, if you're a preceptor for these guys, what I'll tell you is it's really important. Don't pass them off to other people. Don't make them feel like you don't want them around. When you do, when you try to pass them off to other people, we'll be like, hey, go spend some time with so-and-so. And, you know, maybe it's because you want to go get a cup of coffee, or maybe it's because you have other things you want to do, or you're just not in the mood that day, whatever the case may be. Anytime you brush off your preceptors like that or try to send them with somebody else, it makes them feel unwelcome. And that's the last thing you want to do. You want to feel welcome and confident, and they want to feel confident in you. Now, for both new and experienced nurses, one of the most important roles in being a preceptor is to help them socialize to the unit. Make sure that they know where the bathrooms are, the break rooms, where to go for food, where to go to the bathroom, where to, everything you could possibly need. They need to know all that stuff. And a lot of that stuff kind of comes up as it comes up, but make sure that you're not only showing them kind of the things that you kind of take for granted because you see them a million times, but help them socialize the unit. If there's a nurse that sometimes needs a little bit more of a gentle touch when you're talking to them, make sure that they know that. If there's a doctor that's going to be hardcore, or there's going to be a doctor that's going to be maybe a little bit harder on the nurses than the others, give them a heads up on that. Give them a heads up on the social aspects, the unwritten rules of the department. In many departments, there's an unwritten rule that you don't sit in the secretary's chair. You just don't. And if that's an unwritten rule in your department, make sure they know that. Make sure they have that idea so that they don't make that mistake. With both populations, what you want to try to instill in those preceptors is qualities that have been recognized, hopefully, in you. your clinical competence, your desire to take care of patients in your department, hopefully your good attitude about the department, and being a kind, caring provider. Now, if you struggle with any of those, then maybe you're not the best preceptor, because what you don't want to do is you don't want to be burned out, grouchy and cranky and unprofessional, and then have someone else see that behavior because they'll model that behavior. I'll never forget when I was working at a large academic medical center and I was working their PRN. I had spent about 10 years in the department and was actually working someplace else and just kind of picking up weekends and such. I'll never forget, I came in for a weekend shift and they decided that they were going to put me in the an area that they called MEC, the Metabolic Encephalopathic Care. Essentially, it was for inebriates and psych patients. And I loved taking care of patients in that area. I think I always enjoyed it and had no problems taking care of those folks. Some of the staff that were there day after day probably got a little bit burnt out. But me as a casual pool, I was happy to take care of the drunks. I take good care of them. I remember working with a nursing student, and she was kind of nasty to the patients. She wasn't very pleasant. She was barking orders. She's being very demanding, and she was working as a tech in that department. And I remember looking at her going, "What are you doing? Why are you acting like that?" And she just kind of looked at me like, "What? I don't know what you're talking about." And I go, "You're acting like a 10-year hardened ER nurse." And she's like, "Oh, yeah. Yeah." She's like kind of smiling. I go, "That wasn't a compliment." I go, "You're acting like an old burnout." I go, "You need to be nice to these people." And she just looked at me and she's like, "Well, you don't know. You don't know what it's like here. You're only here once in a while." And I was like, "Slow your roll there, lady. I've been here for over 10 years in this department, and I put more than my fair share of 40-hour work weeks in this building. So don't tell me I don't know, because I know." So if you're burnt out or if you're not in a good place mentally, then you don't need to be precepting people. They will pick up your good, they will pick up your bad, and everything in between. So just kind of keep that in mind. If you're precepting and you do have to show them something that's kind of a shortcut or kind of not the way it's supposed to go, own it and just say, "Hey, this isn't what we would normally do, but I'm going to do this because I have to right now." But also don't make it a norm that it's okay to break rules. You never know where that's going to go. I always tell people when they're precepting to act like the director is watching them, and what would the director want them to know that they're sharing? As a leader, I don't know how many times someone has showed me something and I said, "Who taught you how to do it that way? Because that way is not right." Oh, so-and-so taught me that. No, we need to teach you the right way. If you can't teach them the right way, then don't bother teaching that skill. You're just going to get them in trouble and maybe put your patients and your peer at risk. I'm going to end this episode with a quote from Einstein. Einstein once said, "If you can't explain something simply, you don't understand it well enough." Make sure you understand your role, your job, and your skills well enough that you can explain it simply to pass it on to the next generation. I hope you enjoy precepting. I hope it helps you find joy. It's a great way to re-spark your passion for working in the department and your passion for taking care of patients. And you know that's what we're all about here at Art of Emergency Nursing, is re-sparking your passion, re-sparking your light. So with that said, I'll talk to you again tomorrow, and I'll tell you how you can share information with your preceptors that just may make the information stick a little bit better. We'll call that part 2. Have a good shift.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.